Now back to our top story, the health department revealing 8 out of the 35 Delta variant cases in the country are still active. Patients were earlier tagged as we covered. One of the cases was detected in Gingoog City in Misamis Oriental. What are local officials doing to prevent the spread of the more transmissible variant? We go above and beyond the headlines with Gingoog's Assistant City Health Officer, Dr. Agnes Centino. Dr. Centino, good evening. And
Good
welcome
evening
to
po.
Newsnight,
Good evening
ma'am.
sa
Can you tell us
lahat.
first what is the yes, ma'am? What is the
Yes po.
status po of the case there in Hingoog City? Where exactly is he or she confined, or is he or she in an isolation facility, hospital po o
Yes.
isolation facility?
Yes, actually magbigay ako sa inyo ng timelines kung paano 'yon na na-detect namin. Kasi nung una, there were 6 in a household, and it is composed of the wife, the husband, the 10-year-old child, and the grandmother who is a senior citizen, and the 2 helpers. And then it was the poor or the wife who had the symptoms and submitted for isolation and testing. So ang nauna is yung wife na nagka-COVID positive kasi admitted siya. Pagkatapos ng admission na na-detect siya na positive, na-isolate din namin yung lahat ng members sa family, tapos sinitest namin at naging positive din sila. 3 days hospitalization yung wife na siya ang apor na siyang palaging in and out ng bahay. Tapos isolated siya, na-admit siya. Tapos pag 3 days after hospitalization, naka-step down siya sa aming treatment facility. Yung mga other members of the family who were also tested positive were also isolated. But then during that time, they were all asymptomatic, including the baby. So lahat sila asymptomatic except for this apor, the wife of the mother of the baby. So after that, after sa random sampling, nakita yung nanny na naging Delta variant siya. So isolated naman sila, na-recover naman sila lahat after 25 days of isolation. So pinabalik namin yung re-swabbing sa lahat sa members sa family. So sa 4 nila, the nanny, the other helper, the baby, and the mother of the baby were still positive, pero medyo hindi na masyadong mataas yung CT value nila. Tapos yung husband at saka yung 64-year-old mother nila ay naging negative na. As of today, isolated pa rin sila under observation and monitoring, pero lahat naman sila talaga is asymptomatic at the start. Yung na-identify natin na Delta variant has no history of travel. Kasi nasa bahay lang sila, bali in-house sila, naging nanny siya sa baby. So wala din siyang bakuna. She is a 48-year-old married. Wala siyang napuntahan na ibang lugar. So pagkatapos ng ano nila, ng isolation, naging negative na yung dalawa, yung husband, yung father ng baby at saka yung mother ng husband. So as of this moment, wala kaming ibang nakita ng rise ng mga cases kasi nag-rise lang ang cases namin nung May at saka yung June. Mataas talaga, nag 300 times fold sa previous namin na mga positive. At dami rin kaming mortality noon. In a month of June, meron kaming 26 mortality na related sa COVID. After that, last June 16 up to June 30, nag-declare ang aming LGU na maging MSCQ. So pagkatapos noon, nag-decline na, slowly nag-mellow down yung mga cases kasi ginawa namin yung aggressive naming contact tracing up to the second and the third generation of the identified case. But kahit pa hindi siya
Yes, ma'am.
identified case,
Ma'am.
yes, ma'am. Kahit hindi pa siya identified case na Delta, ginawa pa rin namin yung massive, aggressive na contact tracing.
Well, ma'am, Thank you very much. Napaka-kumpleto po ng information nyo. You're very forthright with the information you're giving us and we really appreciate that po. Just a few questions po. No? So itong yung nanny o yung yaya ng bata na nag-positive for the Delta variant, ang sabi po ninyo, no travel history, saan po siya na-isolate? Nilagay po siya sa isang isolation facility? Or sa ospital? Kasi yung mother, yun yung na-ospital. Pero itong yaya, ano nangyari po sa kanya?
Ang mother na hospital kasi symptomatic siya. Yung yaya, yung baby, and the rest of the members of the family, nilagay namin sa isang compound kasi yung papa ng baby is kagawad sa barangay. So be-hurt siya. Nilagay namin siya ng isang compound. Oo. Sila lang talaga ang meron doon kasi of the 10-year-old baby, 10-month-old baby.
Oh, okay. Okay, so isolation facility and then like you said, asymptomatic, no? And then you said, so no travel history, pero at silang lahat sa bahay, ang lumalabas lang yung mother, yung wife, I mean. Hindi po ba? So, pero yung wife, yung mother, hindi po siya Delta variant positive, no?
Hindi pa namin alam. Hindi namin alam. Hindi namin alam yung ano niya,
I see.
Yung
okay.
variant
so
niya. Kasi
wait. So but you were able to find out na yung nanny o yung yaya, random sampling. So i-check nyo rin ba kung yung iba, kasi sabi po ninyo yung buong household hindi po ba?
Yes.
So will you also check kung yung husband, yung wife, yung child, yung grandmother at yung isa pang helper, kung Delta variant din po sila? You will still you have submitted their samples already?
Actually, nakuha yung nanny na sample niya sa random sampling. After after na sa isolation namin na nalaman na naging variant siya. So as of today, hindi namin alam yung ibang contacts niya kung Delta pa rin sila. Pero I assume kasi nasa isang bahay lang sila, baka Delta din sila. Pero as of today, after umabot na sila ng 28 days isolation, wala naman silang simptoma, at saka yung pag-swab namin sa kanila, yung 4 na kasi kanila lang ang may positibong result. Na hindi na masyadong alarming yung value nila. Pero yung dalawa, yung husband at saka yung lola, naging negative na sila as of yesterday.
Okay, pero ma'am, because you're saying you are assuming na Delta variant yung ibang nag-positive. So, pina-genome sequencing nyo rin po ba sila? Para lang ma-check kung Delta din.
Wala na ma'am, kasi isa lang ang na-identify sa bahay nila. Tapos, lumagpas na yung 28 days na ata after sa na-identify yung nanny.
Okay. All right. So, in short and simple language, ma'am, ang sinasabi po ninyo, we don't have to worry too much na kahit may isang positive Delta variant case sa Gingoog, sa city po ninyo, hindi na po tayo kailangang mag-alala na hindi na po siya nag-spread. Is that what you're saying?
Actually, ma'am, sa nakita namin ngayon na declining yung cases namin, makita natin na medyo na-contain namin siya kasi siya lang ang identify namin. Pero sa nakita namin na rising cases nung June at saka May at saka daming mortality, meron kaming pagdududa na talaga ibang variant yun. Pero hindi namin yun na genome sequencing. Tapos pagkatapos nung nag-declare kami ng MSCQ, walang movement talaga ang mga tao. Tapos massive ang contact tracing namin. At saka it was already 28 days na ang nakalipas bago namin nalaman na Delta yun.
Sige po, ma'am. Okay. Yeah, Doctor, just one more question na lang po, no? So, for Gingoog, are you aware of yung rate of vaccination, no? The percentage of those vaccinated doon sa buong population po ng Gingoog City?
Yes, ma'am. Meron, nag-roll out kami karon ma'am, ongoing ang roll out namin ng vaccination. Pero kung titignan natin yung mga target namin na A1, A2, A3, medyo mababa pa sila. Hindi pa kami umabot ng 50% sa target namin, lalo na sa mga senior citizen. Kasi konti lang ang bumalik for the second dose. Pero ongoing pa rin kami ngayon sa second dose ng iba sa A1 at saka A3. Tapos, may strategy na kami ngayon, ma'am, kasi yung Gingoog City has 79 barangays. 51 of those are in the rural areas. So, ang ginawa namin, kinuha namin yung mga matatanda doon, at pinahakot namin, mayroon kaming sasakyan, dalhin namin doon sa fixed site namin, binakuna namin sila. Pero puro at binigyan din namin sila ng mga pagkain kung abutan sila ng lunchtime at saka ibalik namin sila doon sa rural areas kasi malayo yung 51 barangays ma'am sa highway.
Oo, oo. Pero maganda po yung style ninyo. Talagang sinusundo nyo na lang para wala ng problema. But anyway, sige, sige po, Dr. Agnes Centino, I wish we could speak to you more. Dami ko pa sanang tanong, kaya lang ubus na po yung oras natin. I hope to speak to you again, ma'am, very soon. Thank you very much, Dr. Agnes Centino, ang Assistant City Health Officer ng Gingoog City sa Misamis Oriental, kung saan po ay nakakita ng isang case ng Delta variant ng COVID.